Hi, I'm Rob Abbott, Chief Executive Officer and Executive Director of ISPOR, the largest and most influential professional society dedicated to the advancement of health economics and outcomes research across the world. Joining me today is ISPOR's Chief Science Officer, Dr. Laura Pizzi, and our Associate Chief Science Officer, Mitch Higashi. We've gathered today to reflect on the key takeaway messages from ISPOR's International Conference 2024, a conference that really shined a bright light on the concept of whole health and what whole health might mean in terms of a new paradigm for the delivery of healthcare across the globe. Before we delve into the details, though, I want to say a little bit about ISPOR and our mission. ISPOR is dedicated to advancing health economics and outcomes research because we passionately believe that the best healthcare decisions and ultimately the best outcomes for patients are built on a foundation of rigorous scientific evidence. And equally, that commitment is reflected in our exciting new vision, a vision of a world in which healthcare is accessible, effective, efficient, and affordable for all. It's a bold vision, and it will take many years to realize it, but we are committed to bringing the full force of health economics and outcomes research to bear on decision making so that we make that vision a reality. And our commitment in that regard was very much on display at ISPOR 2024. The entire conference was built around the idea of whole health and what that means in terms of a new paradigm, how artificial intelligence, patient-centered research, policy development, and regulatory and real-world evidence come together to forge new ideas and new opportunities for the delivery of healthcare across the globe. I'd like to draw ISPOR's Chief Science Officer, Dr. Laura Pizzi, into the conversation now and say, Laura, ISPOR 2024 was really a feast for the mind and the heart. But let's start with this idea of whole health. What did you take away from ISPOR 2024? And more broadly, where are we going with this as a society?
Right. Well, Rob, as you know, whole health is also one of our major topics for Strategic Plan 2030 because we've identified it as a theme that will have a significant influence on health and well-being for the next 5 years and to come. And really what whole health is, it's a recognition that individuals don't get better. They don't achieve health and well-being simply by interacting with the healthcare system. But they also have other factors such as their social circumstances, their economic circumstances, their access to food, their access to transportation. And all of these things come together really to determine how healthy someone is. And the reason why this is so exciting is because we've been living in a somewhat black and white world in healthcare and in HEOR specifically, because we've been thinking in a very medico-centric or healthcare-centric way. And to some extent, that's been due to the limited data that we've had available. But now with this new thinking towards whole health, it's making that black and white painting turn into something color. We are adding colors through our understanding of the science on these other domains of whole health and also the data sources that are available to us. So it's a really exciting time for us in healthcare, but also for HEOR specifically, because it brings us an opportunity to not just think about how well treatments work in any given patient or any given population, but also to think about, well, what else can be done in that individual's contextual situation, in their own ecosystem, that can also improve their health. So maybe it's taking a medication in addition to having some environmental intervention or nutrition intervention. But really it's going to be a combination of different interventions that we can use, some of which are medical and some of which are not, that's really going to improve health and well-being. And why this is so exciting for HEOR specifically is because it's opening up this possibility for us to think more holistically about the place of medical innovation in the context of some of these factors, and specifically to expand our methods and models to account for them.
You know, I loved what you said there in terms of the transition from, you know, a black and white painting to color. And I know that we, for some years now, have talked about social determinants of health, for instance. What's the relationship between whole health and social determinants of health?
So they are related. Social determinants of health really arose mostly out of the public health world, from which we can learn a lot in HEOR. But social determinants of health are things like an individual's environmental circumstances, their economic circumstances, their access to medical care, their neighborhood. So these things do relate to whole health. It's just one of the, I would say, methods or models that we have available to us to better understand whole health.
Laura, this is fascinating. So let's now maybe drill a little bit deeper and pull some of the key takeaways with respect to real-world evidence. What really struck you as particularly important coming out of ISPOR 2024?
Sure. Well, as you know, real-world evidence is a major theme for us at ISPOR. In addition to the conference, we also have a steering committee focused on real-world evidence and a very vibrant SIG. So we're working on this topic every day. But I think it might be helpful for our audience to first explain what real-world evidence is and why it's such a big deal. So for the past several decades, most of medical evidence, or at least the most influential medical evidence, has been based out of clinical trials. And clinical trials are great because you're testing a treatment in a very specific population, and you're randomizing people to get one treatment versus another, making it a very rigorous form of evidence. But unfortunately, what we lack from that type of research is an understanding of how well treatments work in the real world. And that's where real-world data and real-world evidence come in. And what it is we're really taking data that exists, they're collected from various touch points in the healthcare system, such as medical claims, or electronic health records, or patient registry data. And we're making sense of that real-world data to understand a lot more about how well the treatment works in the populations that are actually going to be receiving it in the real world. So we believe at ISPOR that real-world evidence is absolutely critical to making the best healthcare decisions for patients. Now, in terms of where the science is at, it's very interesting because I think 10 years ago we were talking about very different things than we're talking about now. You know, I would say at first there was a lot of focus on transparency of real-world evidence data sources and methods, understanding how to determine if any given data source was fit for the purpose of the research questions you were trying to answer. And there was some focus on the methods as well, mostly in the realm of understanding safety. For example, are there significant adverse events that happen after a population receives a drug? But now where the frontier really is in real-world evidence is in determinations of effectiveness. So we're going into a realm with real-world evidence that clinical trials have effectively kind of owned or been the king of for decades. And this is very exciting for us because we're now getting to the point where the data sources are getting better and the statistical methods are getting better to really help us to understand if you have a treatment that you've given to a population and you try to examine it using real-world sources, then how much better does it work? How much more effective is it? So the positive thing about this, as I said, is that this type of data will greatly complement clinical trials. I do, however, think we have to be a little careful because as we take what people perceive as real and we do a lot of manipulations to it, then I think there's a question about trust and transparency. So we always have to be vigilant about publishing our protocols for real-world studies, making sure that we're transparent with our data sources, and really standardizing. Standardization is another huge trend right now in real-world evidence. There was a recent assessment done by IDRHA, which is a European Commission-funded project. They looked at real-world evidence guidelines, and they've really just published their draft assessment. They found 50 RWE guidelines some of which were focused on regulatory purposes, some of which were focused on health technology assessment, some of which were both, some of which were focused on pharmaceuticals, some of which were focused on devices. And I think right now, we're clearly in this era of standardization. What's going to be really interesting is to see which of these guidelines shake out as the most influential. Mm-hmm. And as you know, Rob, interestingly, we currently have a special task force which is on looking at RWE use in health technology assessment, but it's a guideline on how to make guidelines.
There's so much there actually to unpack, but one of the things you said that I think is particularly resonant for our audience is this idea that real-world evidence is increasingly examining the efficacy or effectiveness of drugs, for instance, after release into the market. You know, there's a sense coming out of a clinical trial of how the drug might perform, how we hope it will perform, but real-world evidence tells us what actually happened, and that's especially important for patients, of course, which is kind of a nice segue into something else I wanted to invite you to talk about, which is the extent to which we're really putting the patient at the center of our work around informing healthcare decision-making. What came out of ISPOR 2024 related to patient centricity that resonated for you?
Yes, Rob. Well, expanding the definition of value was a major focus of ISPOR 2024. We received a lot of fantastic submissions on this topic, and as you know, it's goal number 1 of Strategic Plan 2030, which is to lead the definition, measurement, and use of value in healthcare. And this whole idea of whole health does relate to expanding the definition of value in a few ways. The first is that, as many of our viewers know, ISPOR does have a value flower that does establish through its petals what different dimensions of value are. However, we believe that, and we know from a lot of the content we're getting, that there should be more flowers on the petal. And the reason why is because there are there's a wide array of different value and outcomes that, depending on where you sit in the decision-making process, you might prioritize. And so we really do need to think more holistically about what matters to patients with respect to what their petals might be, what matters to healthcare systems in terms of how they would define value-based healthcare. So these are huge opportunities for us on the scientific side of HEOR. And I will also say that expanding the definition of value inherently will involve understanding where there are differential unmet needs in the population. Because how we calculate value can very well potentially differ in different populations. And this comes into, I think, some equity interests. You know, there are some methods that have emerged, such as the GRACE approach, such as distributional cost effectiveness, which is not new, but is gaining some popularity once again, where we can begin to understand the differential cost effectiveness of treatments based on their equity implications.
That's fantastic. Thanks so much, Laura. Really, really appreciate those insights with respect to your key takeaways from ISPOR 2024. So whether it's whole health, the onset of real-world evidence and the further articulation of real-world evidence, putting patients and the patient voice at the center of healthcare decision-making, or indeed expanding the definition of health. There's just a richness of activity happening within the field of health economics and outcomes research. ISPOR is really leading that effort, and I'm so excited about what we're not only leading on, but what the promise of that leadership can take us towards in terms of a new paradigm of healthcare across the globe. I'd like to transition a little bit now to another important dimension of our work, and that's regulatory evidence in all of its contexts. So I'd like to draw Mitch Higashi, ISPOR's Associate Chief Science Officer, into the conversation now and say, Mitch, as you reflect on ISPOR 2024 and the work more broadly that ISPOR is doing in this space, what jumps out for you in terms of the headline issues related to regulatory evidence?
Certainly, Rob. You know, what really jumps out to me is that more and more regulators are attending ISPOR than ever before. And as we see them present and engage in meetings and dialogue, they are seeking to build bridges. And it is so interesting, this new era that we're entering with regulators, Rob, because it is an era of what I call candid collaboration. You know, you think about a regulator, typically you may think about a big institution, a big building, that these are people who you would never see or hear from. They look at numbers, right? So they're looking at new drug applications and they're trying to figure out, is this drug safe and is this drug effective? But they are coming to ISPOR now because ISPOR is a convener. We bring together many different stakeholders, including the patients that Laura talked about. And they have a new metric, and they are talking about timely. So not just safe, not just effective, also timely. Why? Because they care about patients. These are real human beings on the regulatory side, and they are seeking to build bridges and understand what the patient's needs are. And they have decided that the best way to accelerate drug approvals to get needed medications into the hands of patients so they can access them is to start talking candidly about some of the areas where they want to improve. And so the patient-centered mindset of regulators is so encouraging to me. I think we have a lot of opportunity there, and they are drawn to HEOR because HEOR is faster science. So in other words, as Laura talked about real-world evidence is a faster method than a long clinical trial. As we think about what is the long-term projection for a patient, what will it look like long-term, an economic model or a forecasting model is faster than a long registry. Now, clearly there are trade-offs, but as we stay to our principles and our commitment to drive the best science, we believe that we can complement the old ways of working and bring together some new ways of working. And then finally, I would say the big insight for me, Rob, was this idea that the regulators are becoming centers of excellence in their own right. And that is because they see the best of the best. So every drug company that uses the methods that Laura was talking about and submits for an application for a new drug, they see the very best submissions and they see common mistakes. And there was an interesting remark that I heard from one of the regulators. They were saying, well, we see this company make a submission and they had this mistake in it. Then we see this other company make the same mistake. And they're asking, why don't they talk to each other? And ISPOR is part of the answer to that. As a convener, as someone who can foster an appropriate and open dialogue centered on the science, ISPOR is the place that can help people smooth out those mistakes and get everyone on the right track. You know, why? Ultimately for patients and to address unmet medical need that Laura talked about.
That's fantastic, Mitch, in terms of just painting that bigger picture. I know that there are probably two topics in particular that our audience is particularly interested in. One is artificial intelligence, and the other is drug price negotiations, because these are very active, particularly in the United States. Can you comment just a little bit on AI and drug price negotiations in the context of ISPOR 2024 and the work more broadly that ISPOR is leading?
Certainly, Rob. And what we've seen at ISPOR 2024 is that AI is quickly entering our field, and it promises to transform our profession as it is transforming other professions. 5 out of 10 of the top most attended sessions at ISPOR 2024 were on the topic of AI. And so while AI has great promise and potential, we still hear from our members and we hear from our conferences that human oversight is critical. And so there are many tasks that AI can be applied to to summarize information and take time out. That is typically a tedious task for scientists to perform, but you still need human oversight. And as the analysis gets more and more sophisticated and more complex, you need human judgment. So that was one of the big aha moments for me, is the computer will read the papers that you submit to it, and it will summarize the papers that you submit to it. But the question of, is this a good paper? Is this a good quality paper? That requires human judgment. And fortunately, we have short courses in our education department that helps scientists develop good judgment. And so it is that human oversight that we think will ultimately prevail and allow us to responsibly adopt AI and make sure that it is fair and properly deployed so that patients can ultimately benefit from it.
Fantastic. And briefly, on drug price negotiations, what was the buzz coming out of ISPOR 2024?
The buzz, Rob, is this shift in what I call the center of gravity. So if we look historically at ISPOR's role in drug price negotiations were pretty decentralized, and it would happen at a local level. But what you see now is this strengthening, growing role of central governments in the price value negotiation. So central governments, via these vast sweeping legislations that have been passed both in the US and in Europe, they are playing a much stronger role in the price value debate. This is something that we have to adapt to, Rob. This is something that our members need to adapt to. And ultimately, when Laura talks about comprehensive value assessments, that's what ISPOR is for, right? So we have the value flower. We have already mapped out a framework of what should go into a comprehensive value assessment. We just want these central governments to be making the right decisions based on the right information. And we think that our approach to comprehensive value assessments is a voice that needs to be heard. And fortunately, because these government stakeholders are increasingly interacting with ISPOR, we think we have a voice.
Thanks so much, Mitch. Really appreciate that insight. These are incredibly exciting times in health economics and outcomes research, and therefore very exciting times for ISPOR as we seek to lead change in healthcare globally by leveraging the evidence that health economics and outcomes research draws forward. I'm incredibly inspired by our membership and the work that we're doing, and I want to pledge that we will continue to step onto the frontier of health economics and outcomes research, because ultimately this is about bringing the very best that medicine has to offer to the greatest number of patients at reasonable cost. And that is what is at the core of our mission and our vision. We want to be leading change in healthcare, and what that really means is we want to bring healthcare to people in a way that is accessible. They get the care they need when they need it. The care is actually effective. It's efficient in its use of public dollars, and it's affordable for everyone that needs access to care across the globe. I invite anyone who's interested in this mission and vision to join us, become a member of ISPOR, attend one of our conferences, get engaged with our task forces or our special interest groups. We are a big tent, and we welcome everyone who has a shared interest in changing healthcare. And if you want an opportunity to get involved, consider joining us in Barcelona this November 17th to 20th, as global healthcare leaders will come together for ISPOR Europe 2024. This will be the biggest gathering in the world this year of health economics and outcomes research professionals, and I look forward to seeing as many of you there as possible. Thank you.